You're watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, how to restore and maintain a youthful appearance with some of the new techniques that are available. If you are not happy with the way you are aging, and by the way, this is going to be a very interesting show today. We're changing it up today. And with us, we have a board-certified facial plastic surgeon that is world-renowned. So if you're not happy with the way you're aging, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, how to restore and maintain your youthful appearance. With us, we have an expert on the topic, board-certified facial plastic surgeon, Dr. Gregory Keller. Dr. Keller, always a pleasure to have you on the show.
Always a pleasure to be here, Randy.
Now, before we get into today's topic, because I guess there's a lot of new technology, new techniques that are, I guess, allowing for even more natural appearances for facial rejuvenation. But for those who don't know you, tell us a little bit about your practice. I mean, what kind of patients do you see?
Well, my practice is really all ages, Randy. I mean, we have the young girl who's interested in a rhinoplasty. We have people who want to maintain their skin and keep that in shape with its natural color, texture, and appearance. We have people who are a little older who want to do something about their eyes. We have older people who want to do and lift the face, which occurs mainly around the time of menopause, but can occur earlier.
Okay.
Mid-facelifts, there are all kinds of things and all kinds of ages that we deal with.
Let's begin with the younger patient. I mean, at what age are they coming in now to do
Well,
things?
they come in at all ages now, Randy. You know, you'll have younger people with acne. We have devices that'll really help that and clear things up, whereas before Accutane was a necessity. People will come in when they start to notice pores or little wrinkles, and there are a lot of tools, Botox, intense pulse light, and the newer fractionated resurfacing devices that can really help that. These are things with minimal or little downtime or risk that can really make a difference.
Okay, now, do you think there's a benefit, and we talked a little bit about this off camera, of going to somebody that does both? When people ask me, I said, if you're going to go, and this is what I've learned after doing over 1,000 of these shows, is that go to somebody that both does facelifting, but also does fillers and all the minimally invasive stuff. So that way they give you an honest opinion. They can't help but tell you what's best for you. I mean, is that the way you feel? Is that accurate?
There's an old saying on that, actually, that if you have a hammer, everything looks like a nail. You know, so if you have one thing to do, everything looks like that's what you ought to do. I think it's good to have a repertoire of things that you can fit to the individual patient and tailor for their specific program to maintain and restore their youthful appearance. Okay,
so it's not just all about adding volume, adding fillers. Because I have people on the show, let's say it's a dermatologist, who says it's all about volume. Add volume, you look younger. What are your thoughts on that? I mean, define the young, the youthful face. How do you keep it?
Well, you know, it's a variety of things. As we age, different things happen. The first things happen in the mid-face. The middle part of the face can sag. Can you cover that over with volume? Yeah, but you can also look like you have a rock in the sock type of appearance. So a little volume can be helpful, but it's also helpful to pick those fallen structures up. And if you get people early enough and maintain that, you can do that with a very minimally invasive type of procedure with new devices that Coapt and other people make.
Okay, so you do a mid-face. So now for nasolabial folds, that seems to be what a lot of women that we interview are worried about. Fillers, do you do fillers or do you do a mid-facelift? What do you do?
Well, you know, the nasolabial fold is a very complex thing. There's loss of volume, there's loss of structure, and there's sagging that goes into that. So we try and attack that with a little bit of this and a little bit of that to try to recreate and reformulate the way people used to look. And that's what I think is important. So the answer is we do all of that, but we do it in little volumes to make it look natural.
Do some people come in and say, you know, Dr. Keller, I need a facelift, and they really don't? I mean, do you ever have to talk somebody out of a facelift and do other things? I mean, does that ever happen?
There are those people, definitely. But I think people are becoming very well educated nowadays. And if someone comes in and says, I need a facelift, usually, not always, but usually it's true, they do.
Okay, okay.
Yeah, because the tendency is to try the less invasive things first, and often people have gone through all of that and really want to accomplish something that restores their youthful appearance and the way they feel inside.
Okay, now at the top of the show we talked about how to restore and maintain your youthful appearance. and I asked you off camera, and you said, well, I don't know if I want to say that on camera. But I said, could you make, if I stay with you and I take your advice, in 10 years from now, can I look younger than I look today? And you said yes. So you believe that?
I do. It depends on what you want to do to
Would I
keep
need a
that up.
facelift? Would I need a facelift to do that? Would I just need some of the laser or tightening procedures you use?
Well, I think in your case, Randy, the earliest signs of aging are in the middle part of the face.
Okay.
You know, this area right here. And that has to do with the way our ligaments sag, our ligaments stretch out, you know, because we have ligaments in the face that hold up our structures just like a shoulder. And if you use that a lot and move it around, things are going to come
So you
down.
kind of lift that up a little bit?
You can lift that through minimally invasive things if you start early enough, or if you wait till later, then you know have to do a little more to
Are
do
these
that.
endoscopic procedures we're talking about?
They can be.
Okay.
They can be, yes. Endoscopic facelift for the younger woman where we make little incisions and lift things can be a very good thing. You can you know, there are people who think you have to rejuvenate the whole face, but really if you look, everybody ages a little differently and you need to tailor a neck. Men often want their neck done and their eyes. Those are the two things that tend to bother them the most. Women, on the other hand, want a balanced look. So everybody's different.
Do people want to look different? They want to look younger, prettier? What do they tell you? I mean, on the consult, do they say, I just want to look different, or I want to look prettier? What do they say?
They want to look like they used to look before it happened, because what happens to women particularly is that they age all of a sudden. And it's not directly connected with, but often correlated with menopause.
Okay.
Why they call it menopause, I don't know, you know, because it happens to women. But what happens is that, bam, something happens real quick. So women will see plateaus of aging that happen at various times that happen very quickly.
Okay, now you say early treatment is better. You say, Randy, you know, I want people to know that the earlier they get in, I mean, you could literally slow the appearance of aging or stop the aging process?
Well, you know, I didn't believe that early treatment was good when I started out, but I was young, you know.
All right.
I hadn't gone through menopause with all my friends and, you know, et cetera. But what happens is that if you do little things, you know, starting early, you can maintain your appearance without a doubt. Just so that you don't do too much, that can be a
So a person 40 that's watching this, so we know that there's a 40-plus crowd, very sophisticated, that watches this show. A 40-year-old woman or man starts with you. You're saying you could probably make them look that age for 10, 15 more years? Without dramatic
Well, you don't know
stuff to
how
their
many
face?
years, but definitely you can keep up their appearance, no
You could
question.
slow it. You could stop it almost. The appearance
Yeah,
of aging.
you really can. It's really interesting. And technology is there, you know, whether I do it or someone else, that if you're really committed to doing that and maintaining and restoring your youthful appearance, you can do that for quite a while.
Okay, let's start with the minimally invasive, and I have questions about the facelift and mid-facelift and this co-op facelift. Okay, 40-plus woman or even mid-30 woman or man, where do you start as far as technology? They have some sun damage, I guess, just a typical person.
There are no typical people.
All right, okay, okay.
I mean, everybody's different. Everybody, particularly in California, which is a very diverse society, people have different skin textures, colors, aging, they've been in the sun different amounts. So there's a wide variety of people, but generally if you start early, you're going to start with fillers, with fractionated resurfacing, and we have the very latest type of techniques
This
with
is
that.
heating the underlying tissues and tightening the skin?
Well, partly it's heating little cones of tissue that are separated by normal skin.
So it's a laser or light?
In this case, it's a laser.
Okay.
That's divided into little cones of energy. And in this case, a carbon dioxide or an erbium laser. We use both. It's fractionated resurfacing. And that's a quick healing process that really can make a difference in the skin texture and color. There's intense pulse light. There's combinations of all three, including radio frequency skin tightening. All these can maintain things for quite a while prior to doing anything else.
Do you have to have an eye for this, or does the machine do all the work? And that seems like an obvious one, but how much technique or eye does require the surgeon? You teach surgeons from all over the country.
Randy, I like to see every patient that comes through my door.
Okay.
But I like to tailor a program for them. Now, to save money and to make this economical for a lot of people, either RNs or physician's assistants can do some of the work, but I like to lay out the treatment plan so that it follows the thing. Then I like to see people afterwards to make sure that they're progressing in the direction that they want to go.
Okay, you imply you know, everybody's different, and I'm picking up on maybe there's a cookie cutter approach that's going on in the world of, you know, minimally invasive facial rejuvenation or cosmetic surgery. Is that going on? Because I tried to pin you down and said, okay, so where do you start? And you almost wouldn't say, because it depends on the person.
It absolutely does. You really have to tailor treatments. People come up with a name that they've heard on TV or that's been advertised. And I said, often if a doc has one tool, you know, he has a hammer and everything looks like a nail, you have to have a lot of tools and a lot of capabilities and a wide variety of things, you know, to really fit the person.
Okay, so you believe go to somebody that does both the fillers, has all the technology, lasers, IPL, these what do you call it?
Fractionated resurfacing. You know, there are a million different things to do, and it's important that you have access to all of them.
So go to a medical doctor, you believe, and a facial plastic surgeon? I mean, you have a bit of a bias there?
I do, because that's what I am, but definitely go to a physician's office rather than, you know, to a spa outside. And, you know, the California Medical Board currently has several bills before the legislature.
Okay.
May make this mandatory. I don't know.
Okay, we're going to take a quick break. We come back, the process, what somebody can expect on the evaluation and consultation that you give at your office. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, how to maintain and restore your youthful appearance, possibly stop or slow down the aging process. We'll be right back.
Tried all sorts of cover-ups for bad breath? Try the science of BreathRx. Only BreathRx has Zytex. It attacks the cause of bad breath, keeps working for hours. It's clinically proven for real fresh breath.
Get non-prescription BreathRx from your dental hygienist and now at fine stores everywhere.
Designs for Health is the nutritional supplement brand of choice, exclusively recommended by healthcare professionals.
As a physician, I insist on the science-first approach of Designs for Health. They have synergistic formulations with optimum quantities of therapeutic nutrients.
Designs for Health, the leader in professional brand nutritional supplements.
There's a new secret to looking younger. An advancement so profound, it took a team of scientists years to create. A time machine called Zoom. Getting zoomed is the fastest way to erase years from your looks. Zoom is the most advanced teeth whitening ever. Only your dentist has it. Nothing works like it. Zoom Gel gently penetrates the submicron pores of tooth enamel. The patented Zoom Light super activates the gel through a unique photofenton reaction, breaking down the stain's double bonds. In just 45 minutes, years of discoloration disappear, transforming your smile to wow. To find a Zoom dentist near you, go to zoomnow.com or call 800-891-4895. For your whitest, most confident, most irresistible smile, get zoomed today. Make your appointment at zoomnow.com or call 800-891-4895 today and discover the wow of Zoom.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, how to restore and maintain your youthful appearance. Here we are with facial plastic surgeon, Dr. Gregory Keller. Okay, the process. Somebody goes in, let's pick 40 plus. They go in, they're not happy with the way they're aging. Take me through that process.
Well, I take a look at them, Randy, and I see what bothers them. And I see why it bothers them, because I want to know what they want to do as well as what I can do for them.
So
and
what do they say? What do they say?
Well, they come in for a variety of reasons, and one of the most common things that I hear is that I really feel younger than I look. I looked at myself in the mirror and that's not me.
Is that right? They actually say that? Okay.
Yeah, they just don't feel that age, and there's a lot of talk that 40 is the new 20 and 50 is the new 30 and all of that. Okay. And to an extent it's true. I mean, people are really active nowadays. They're really out there working. You know, they're in the public eye, and they want to feel that they look good to give themselves the confidence that they feel inside. And I think that probably is the #1 reason that I see people, and I think it's a great reason to do things. The other is people, you know, in the public eye, whether they're in sales or working, it's a young world out there. And you know, they want to look young because they feel vital.
But they want to look natural as well. And my fear
Absolutely.
with going to a facial plastic surgeon is you're going to want to give everybody a facelift, and they might look tight or unnatural?
Well, I don't guarantee anything, but I always guarantee them that they'll look natural.
Okay.
And I think that we really accomplish that. I really do.
But is that
At least
their
that's
fear?
my opinion.
Is that their fear? Is that the
There's
number one
There's a
fear?
lot of fear about that they'll look pulled or tightened. You know, there are that group of people that want to look that way, and we just don't do that.
So I know in LA, you're known as the guy for a natural looking facelift.
Yeah.
And they say Dr. Keller's work goes unnoticed because you can't see it.
Well, you know, that's...
I mean, do you feel that way?
Well, yeah, that's a success story if that happens. Because really, when you look at people, there are specific things that age. There's the jowl here, there's the cheek that falls, there's the distance between the eyelid and the cheek that lengthens. You know, the brow can fall downward, the neck sags. So there's a lot of specific things that happen. The skin, you know, gets older and sun damage, becomes crinkly and wrinkly. Now, do you want to pull everything tight? No. You want to make people look appropriate, but you do want to make them look younger. And by restoring those specific anatomic things, you can make them look younger and make them look natural.
Now, anticipating you coming here today, asking a lot of my friends in their 50s, married, and I said, what would your biggest fear about your wife getting a facelift be? And every one of them said they didn't want them to, in fact, they said that they've talked them out of it, that they don't want them to look done, or they don't want them to look strange, or they don't want somebody that they walk around with and they're embarrassed, like that people will stereotype that Newport Beach look. So that can be avoided. That's truly in the hands of the doctor. That's just not the healing process? I mean, is it technique?
Yeah, there are different types of technical facelifts that you can do if you're doing a facelift to make things look particularly natural. And the goal is to do little bits with all areas to maintain that. Now, guys come in and they are worried about their wives, and they don't want to
say that? Is that common, by the way?
Absolutely. The women will come in and say, my husband just doesn't want me to do that, and then I'll see the husband talk, and we'll go over
talk
pictures.
to them for a moment. Okay, so husband's watching. You know, man when he turns 50, they say, and he becomes successful, he gets the fancy car and the boat and those kind of things. The woman still wants to look pretty.
Absolutely, Randy.
And so different desires there. So what do you say to the husbands?
What makes mama happy makes papa happy.
Okay.
Bottom line. And you know, with that, she feels good. She really does. It's amazing how much better women feel when things are restored and they look good. And you know, and it's not about looking top. They just feel that they look good. It gives them the added confidence.
So their concern always is then, just my little survey that I did with 4 or 5 guys, it's the same you're hearing every day, that the husbands don't want their wives to do it because they're afraid they're going to look done.
There are a lot of husbands that are really supportive, and there are people who are just worried that they will look done. There's a wide variety of that, just like anything else. But it really all boils down to what makes mama happy makes papa happy. And if mama's happy, everybody's happy.
Okay, what about men coming in for facelifts? Is that becoming more popular?
It is. And men, more often than not, we'll see really want a natural look. They, if anything, often want to look underdone, but specific things bother them. Most common thing is the neck that just droops like that.
Is the neck an easy one to take care of for you?
Well, the neck is a very complex structure, and that's one of the things we've worked with. We even do ultrasounds to define what's going on underneath the neck, you know, often prior to doing anything. And there are different things that can affect that. It's not just fat, or it's not just skin, and liposuction won't take care of it. Sometimes you have to really get in there and do something to it so that over a period of years that neck looks better. And again, you want a natural looking neck, and that's a very specific type of operation.
The men have the same concerns as women. They want to look natural. But especially it seems like, you know, I wouldn't want to do it because it seems like a lot could go wrong. You could look feminized, you can look pulled or tight or stretched or this or that. But again, you're saying you're convinced that's in the hands of the surgeon.
We don't do that, Randy.
Okay.
I mean, you know, guys are some of the most happy people that I have.
All right.
It's always easier to make a guy happy than a lady.
So there's subtle results could make them look years younger? I mean, you could make a 50-year-old look like, you know, a good 45?
Oh, easily, yeah. And you have to really sit down and see what he wants to do and what he wants, and what areas he wants to correct. And men are very specific. There's specific techniques for men. We see a lot of men because we do hair transplantations. So there are a lot of men coming through our practice, and we're very knowledgeable about that. We're also capable of fixing facelifts with hair that have been raised too high or too low or that. There are a lot of tricks in the industry and a lot of technique. But Men often, as I say, are very worried about the neck, and that's about it, or the eyes. Those are the two things that bother
So
them
bags
most.
under the eyes. So you're not just adding fillers. I mean, there's things you can do.
Oh yeah.
So it's
yeah.
not just about fillers, because I'm more confused than ever after doing this show. Some guys say fillers, some people say, lift the mid-face. What's your opinion?
As I said, if you have a hammer, everything looks like a nail. What we like to do is look at somebody and say, what anatomic things have changed in that individual that bother them, correct those, and then paint the walls and refurbish the skin. And so doing a little bit of a lot of things is what makes things natural.
So bags under the eyes on one person and bags on another person could be, the root cause could be two different things that you'd have to go after with two different approaches?
Yeah, for instance, one man's ceiling is another man's floor. If you look basically at the eye and there's a bag under the eye, it may not just be the bag. The cheek fat could have fallen, so there's a blank look here, an empty look, and the bag can protrude over that. What we call that is the pot belly over fallen jeans phenomena, basically.
Right, okay.
So the bag's out there, the jeans have fallen. So what you want to do is put the bag back and lift the jeans so that the eye doesn't look hollow or misshapen at all. You don't want it to look rounder. You want it to look very natural.
Okay.
Yeah, and what we do is geared toward that very thing.
Now we're just about out of time. One of the things you want to mention was that after a facelift, that oftentimes women will neglect their skin.
Yeah, maintenance is really important. I mean, we're going to put things back, and as I said, afterwards we like to paint the walls because the skin appearance in a little bit of a lot of things, if you lift things and then change the skin and do a little bit of a lot of things, it looks very natural. But then there's the maintenance process, and I think that that maintenance process may involve facials, it may involve light peels at an esthetician, it may involve laser work. There are a lot of different things. And that's why I like to see everybody that comes into the office so we can really work on a custom program that's geared to
So this is
them.
like custom facial rejuvenation you offer, in a way. I wish there was a name for it, because not everybody's doing it the same way.
It is. We offer everything from a economical type of facelift that you see advertised to a more extensive thing. It depends on what people need. And skin rejuvenation, same way.
Okay, what about somebody? I mean, I get a lot of questions because, I do the show. People always say, they're in their late 30s. They want to do something, but they don't want anybody to know. Is it possible to go through some of these, like, let's say, mid-facelift procedures, or, and obviously the minimally invasive stuff that you could hide from your friends, but could you do some mid-face stuff, mid-face lifting, and their friends won't know?
Well, Randy, we're all number one with ourselves. Try and remember what your best friend's mid-face looks like.
Okay.
That's
a good point.
Absolutely, that's possible.
Yeah. Is it true, by the way, and I talked to a plastic surgeon, that the people that are coming in for facelifts or these minimally invasive stuff, these are very positive people. These aren't people that are kind of down in the dumps about their appearance. These are positive people that just want to kind of pick it up a notch, move to the next level. I mean, do you find that?
For the most part, I think that there's been so much publicity that people really realize what these procedures can do and are not at all unrealistic, with some exceptions about what they want to accomplish.
Well, this has become very mainstream now.
Extremely
you've seen
mainstream.
a lot of changes. You've been around for a while.
Extremely mainstream, but the average person who comes in, whether they be a billionaire or someone that we work with at UCLA, really just wants to look better and look good. And they don't want to look dumb, definitely.
Okay, so 7-day downtime, tops in a lot of these things. I mean, if everything goes okay.
It varies from 3 days to 2 weeks on average. Now, more extensive type of work that's really extensive and involves a lot of different things can take longer, but people know that going in.
How long does a facelift last? So somebody gets their facelift at 50 and now they're 80, and 80 is very young today.
Yeah.
I mean, do you do a lot of these touch-ups or redos, or what do you call them in the world of?
Well, that's really interesting, Randy, because proportion-wise, and not in absolute numbers, because there aren't as many as baby boomers, but proportionately, the largest growth in facial plastic surgery is in the 75 and up category.
Is that right? First time or second time?
It's often second time, but can be first time.
Now, by the way, if somebody waits until they're 75, 80, I mean, is that ideal to get them the first time around for you?
No,
is that when you want to see them?
No, I'd much rather do them younger, but I find that a lot of 75 and 80-year-olds who come in have avoided doing this because there used to be a stigma, now it's mainstream, and they all say, I wish I'd done it sooner.
I want to ask you this question, get your opinion. Okay, so you take two 38-year-old twin sisters, okay, and you maintain one, and then you take them out 10, 15 years. I mean, will one look, and let's say a mid-facelift for somebody in their 40s, okay, twin sisters. In 15 years later, would one look noticeably younger?
Twins are very interesting because, you know, I've done a lot of twins for some reason. I don't know why.
Okay.
Yeah, and what happens is if you do something to one, the other one's going to be in to do something. They're very attached. So, you know, honestly, I haven't seen one twin unless they were separated at birth or something.
Okay, but theoretically, would one look noticeably younger 15 years after the procedure?
Well, I think so, but again, I haven't done any twins that haven't had the other twin
So
come
the other
in.
one always does it?
There's always
You
one.
put them in the same room, you do them at the same time?
No,
I'm kidding.
there's always one twin that comes in first because he's the brave twin or she's the brave twin. And then, you know, when everything turns out great, the other twin will usually be in. They may want to do something a little different, but, you know, a lot of it is, twins are connected, that's all.
Okay, what about safety? Does safety keep people from doing this? As they say, going under the knife, things like that. I mean, are there still a lot of fear about it?
There is, and there are risks and benefits to any surgical procedure that you do. The minimally invasive stuff is, while their risk has gotten much better and much less risky, again, the odds of you having a problem with us are about as low as they are anywhere.
Okay.
And everybody has to know the risks, and we inform people of that. But still, it's really rare, and often it's said that you stand a better chance of, dying in an auto accident in Santa Barbara than you do of having a serious problem with a facelift.
Okay, now, for the people watching this that just have a tough time doing something nice for themselves, their kids, they put them through college, everything else. How do you give them permission to do something nice for themselves? They're not happy with the way they're aging.
Well, often that's the type of person I see. They've got the kids out, the kids have been through school, mom has taken care of them, and now she wants to do something for herself. That's really common. Almost all of the time she feels perfectly great about it. Matter of fact, she's the one that mentions that to me. Time I did something for myself.
Good. All right, well, always a pleasure having you on the show.
It's been fun, Randy. Thanks.
Thanks. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, you can see it on wellnesshour.com. You could do a search for Dr. Keller. We've had him on the show at least 5 or 6 times. You could see any one of those interviews. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.